Hello everyone, my name is Dr. Shashikiran. I work as surgical gastroenterologist at Sapthagiri Institute of Medical Sciences and Research Center. So, who is a surgical gastroenterologist? ಹೆಸರಲ್ಲೇ ಇರೋ ಥರ gastroenterologist. Basically, ಅಂದರೆ anything related to our GI tract, starting from food pipe, that is the esophagus, stomach, small intestine, large intestine, liver, pancreas, appendix and abdominal wall hernias and all. So all these are my areas of expertise. So how do we do the surgeries? So there are different modalities. ಎಲ್ಲರಿಗೂ ಗೊತ್ತಿರೋ ಥರ ಒಂದು ಓಪನ್ ಸರ್ಜರಿ ಇದೆ, ಒಂದು ಲ್ಯಾಪ್ರೋಸ್ಕೋಪಿಕ್ ಸರ್ಜರಿ ಇದೆ, ಒಂದು robotic ಸರ್ಜರಿ ಇದೆ. So laparoscopic is the latest modality and most of the surgeries in Sapthagiri Institute of Medical Sciences is done laparoscopically. What is the advantage of laparoscopic surgery over open surgery? So the main advantage is the kind of cut we make in laparoscopic surgery. So in open surgery andre it's a huge cut. So basically pura abdomen ne open madbekagutte. Laparoscopically andre we make minute holes on the abdominal wall and through these holes we operate. So what is the advantage? As it is very obvious. So the cuts are very small, so the post-operative recovery is very fast. So patients ke normally open surgery ಮಾಡಿದ್ರೆ ಸರ್ಜರಿ ಆದಮೇಲೆ 5 to 7 days ಇರಬೇಕಾಗುತ್ತೆ. ಲ್ಯಾಪ್ರೋಸ್ಕೋಪಿಕ್ ಸರ್ಜರಿ ಮಾಡಿದ್ರೆ most of the times 1 ಅಥವಾ 2 ದಿನದಲ್ಲಿ we will discharge the patients. The next question that's normally asked is, do you treat cancer patients also? So any cancer related to GI tract comes under our purview. So most of these patients are operated by surgical gastroenterologists only. So that includes cancer of the esophagus, that is cancer of the food pipe, cancer of the stomach, cancer in liver, cancer in pancreas, cancer in small intestine, cancer in large intestine, cancer in rectum. So any cancers related to these organs are operated by a surgical gastroenterologist. So do we treat liver diseases? Yes, definitely. So that's also under our purview. So any disease related to liver, be it hepatitis, be it any tumor in the liver, be it any cystic lesions in the liver, all these can be operated upon. Not all liver lesions would be requiring surgery. Some can be treated by medications, and one of the surgeries definitely laparoscopically it can be dealt with. One important aspect about surgical gastroenterologist is that we cater to patients who are overweight also. So ತೂಕ patients ಜಾಸ್ತಿ ಇರೋ patients we operate. So ತೂಕ ಜಾಸ್ತಿ ಇದ್ದರೆ ಏನು ತೊಂದರೆ ಆಗುತ್ತೆ? Most of these patients will be having diabetes, hypertension and all. So after a surgery is done in these patients, ಒಂದು weight reduction ತುಂಬ ಹೆಲ್ಪ್ ಆಗುತ್ತೆ. So with weight reduction, ಶುಗರು, BP ಎಲ್ಲದೂ ಆಟೋಮ್ಯಾಟಿಕಲಿ ಕಡಿಮೆ ಆಗುತ್ತೆ. So all these surgeries are also done laparoscopically and we have been successfully doing this kind of surgeries at our hospital from 4 to 5 years. Then the most important and very common subject is the hernia. So what is a hernia? So basically hernia ಏನು ಅಂದರೆ because of the weakness in the anterior abdominal wall, patients tend to develop protrusions in these regions. ಇದಕ್ಕೆ hernia ಅಂತ ಹೇಳ್ತೀವಿ. So there are different kinds of hernias. So one which is very common is the inguinal hernia, that is a swelling that happens in the groin region. And the other common hernias are in the umbilical region and paraumbilical region. So these are the two common locations wherein hernia happens. So ಈ ಥರ ಎಲ್ಲ ಸರ್ಜರೀಸ್ನು normally we operate laparoscopically only. Open surgeries ಮಾಡಿದ್ರೆ the post operative recovery pain ಎಲ್ಲ ತುಂಬ ಜಾಸ್ತಿ ಇರುತ್ತೆ. That's why we do the laparoscopic surgery in these patients, and most of the times patients get discharged in a day or two following this laparoscopic hernia repairs. So last but not the least, the most important topic is how common is cancer of GI tract in India. So it's the incidence of these cancers, especially GI tract cancers, the incidence nowadays over this past 5 to 10 years is increasing in an enormous proportion. The reason being the kind of the contaminated water or food now tinnadrinda, so it directly affects our GI tract, and cancer of the stomach and cancer of the colon has increased in enormous proportions. So early detection is very very important. ಸೊ ವೆನೆವರ್ ನಿಮಗೆ ಏನಾದರೂ ಹೊಟ್ಟೆ ನೋವು ಬರ್ತಾ ಇದೆ, ತೂಕ ಕಡಿಮೆ ಆಗ್ತಾ ಇದೆ, ಅಥವಾ ಹೊಟ್ಟೆ ಹಸುವಾಗ್ತಾ ಇಲ್ಲ, ಮೋಷನ್ ಹೋಗೋದಲ್ಲಿ ಏನೋ ಪ್ರಾಬ್ಲಮ್ ಆಗ್ತಾ ಇದೆ, ಸೊ ಇಮಿಡಿಯೇಟ್ಲಿ ಡಾಕ್ಟರ್ನ ಕನ್ಸಲ್ಟ್ ಮಾಡಬೇಕು. ಸೊ ಆಲ್ ದೀಸ್ ಕುಡ್ ಬಿ ಅರ್ಲಿ ಸೈನ್ಸ್ ಆಫ್ ಟ್ಯೂಮರ್ ಸಿಟ್ಟಿಂಗ್ ಇನ್ ಯುವರ್ GI tract. So whatever these conditions be, you should immediately consult the nearest doctor, and if at all required, so they will refer to a surgical gastroenterologist. So as I said, ಸೊ ಇವೆಲ್ಲ ಸರ್ವಿಸಸ್ ಸಪ್ತಗಿರಿ ಮೆಡಿಕಲ್ ಕಾಲೇಜಲ್ಲಿ ಅವೈಲೇಬಲ್ ಇದೆ. ಆ್ಯಂಡ್ ಮೋಸ್ಟ್ ಇಂಪಾರ್ಟೆಂಟ್ ಥಿಂಗ್ ಈಸ್ ಆಲ್ ದಿಸ್ ವಿಲ್ ಬಿ ಮ್ಯಾನೇಜ್ಡ್ ಬೈ ಎ ಟೀಮ್ ಆಫ್ ಡಾಕ್ಟರ್ಸ್. ಸೊ ಒಬ್ಬರೇ ಡಾಕ್ಟರು ಕೂತ್ಕೊಂಡು ಎಲ್ಲ ಸರ್ಜರೀಸು ಮಾಡೋಕ್ಕಾಗಲ್ಲ, ಎಲ್ಲ ಪೋಸ್ಟ್ ಆಪರೇಟಿವು ICU ಎಲ್ಲ ಮ್ಯಾನೇಜ್ ಮಾಡೋಕ್ಕಾಗಲ್ಲ. ಸೊ ದ ಮೇನ್ ಅಡ್ವಾಂಟೇಜ್ ಆಫ್ ಸಪ್ತಗಿರಿ ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ ಈಸ್ We have a good surgical team that is comprising of surgical gastroenterologists, oncologists and everyone. We have a good anesthesia team to take care of the patients during the preoperative and in the immediate intraoperative period. And we have a very good ICU backup. So any major surgery madidrunu we should have a very good ICU backup. So namge ICU backup Sapthagiri Medical College alli irodinda, so we form a complete team. So whenever one patient olgade bandre, it's our responsibility to make sure that he is completely cured and discharged from the hospital. So we take care of all these responsibilities. Thank you.